What's your name?
Sir?
Andy Lucas, Upper St. Clair.
Andy Lucas, Upper St. Clair. Thanks, Andy, for picking the question up. Okay.
So this is as much of a comment as...
What's your name, sir?
Nick Thompson. I live in Point Breeze.
Point Breeze, okay.
Which is part of the great city of Pittsburgh.
Thank you.
As much a comment as a question, to my way of thinking about for healthcare reform, the 21st century version of the struggle for public education in the 19th century. And by that I mean a good thing. Public education before the 1860s was basically a mess. The founding fathers didn't have it. They either sent their kids to private schools or no schools. A lot of people didn't know how to read. Public education, what it provided for is, at least in my estimation now, what it does is give us a strong workforce that can read and write. Do math. What I'm going to suggest is for the century coming on, for a strong economy, a strong workforce, we need more than people that can read and write. We need people who can be healthy and strong physically, to do the day in and day out work. Many people have different thoughts about public education, but public education has not hurt private education. Over the last 100 years, which is when public education really kicks in, you see a growth, not a diminishment, of private education. You see parochial education growing. You see a stronger economy and a stronger country. Public education, just to mix in, is compulsory, and we all pay for it. But it does not hurt, in any broader sense, the American population. We need it to go forward. Whatever these costs are, however you calculate it, we need it to be a strong country.
Let me come down here. I'm just going to get on ground level. Get a little, the air up there a little heavy. But no, you made a good point. Where'd you go? Oh, sorry. You made a good point. Look, that's one of the arguments I make for us taking action. This is much bigger than just the healthcare system. It's about the economy. I mean, why should someone go to work every day? They're going to work. They work hard. They're happy at their job generally. And they have health insurance. Why should they go to work every day and worry about those pre-existing conditions? And this is America. Look, a lot of things that are complicated and hard. And it was hard for a group of, 18-year-old Americans, and 18, 19, 20, 21-year-old Americans to go and fight the Nazis who've been training for years and were 28, 29, the best fighting force in the world. And we did that and we beat them. It was hard for us to go to the war. We've done stuff much tougher than this. I mean, and part of this is giving people not just the fuzzy peace of mind, but the assurance that their family is going to be covered when they need it, and that they're going to be covered when they need it. And we don't have that now. Because some people think they're covered, and then a pre-existing condition, or a lifetime cap, or some kind of discrimination that some insurance company bureaucrat dreamed up was found in the fine print years after the coverage, by the way. Just because you're covered, you think you're real secure. You're not with insurance companies. So I think the economic argument is very powerful.